Je suis avec Dante Pieramici à l'Arvo 2025. Dante, you're a specialist of PDP, or you're Retina specialist, but
Yeah.
you use PDP since what, a year, 2 years?
No, I've been involved in the port delivery system development since the beginning. So I have patients now who have had the device in probably 7 or 8 years
Wow,
almost.
nice.
Yeah, and like what patients do I select or use this device with? And it's generally patients that need frequent intravitreal injections. That's the really benefit. I mean, some patients they can get away with an intravitreal injection every 3 or 4 months. That's not the patient for this. The patient that needs an injection every month or every 2 months, they are enthusiastic about trying something else. And so I have to have a discussion with them. It's a surgical procedure, so we're going to have to go to the operating room. It's a small procedure. It's an outpatient procedure, local anesthesia, so it's not a big deal, but they're still going to have a surgery for this. And, they tolerate it well, and usually there can be some visual decrease right away afterwards, but patients do well with the device for the most part. And it's a little bit trickier to refill the device than an typical intravitreal injection. So I think that you have to take more time with it. You know, you have to make sure you wear some magnification and proper lighting and position the patient well. But the refill with the new refill needle, and it really is, for the most part, goes very well. Yeah, in most patients.
And
And
these
so,
patients have two eyes involved. Do you do two procedures?
yeah, it's a good question. I have a few patients who I've done it in both eyes. Usually they sort of want it in the second eye. But even if they get it in one eye, it sort of reduces the treatment burden for that eye. And many of these patients can go 6 months or a year or even longer without a refill. If we looked at the data from the phase 2 clinical trial, we had patients that on average, you could still measure drug a year and a half later, and most of the patients could go a year or more without needing a refill. So that really makes it easy, and then they just get injections in the other eye. But I have seen some other benefits to continuous suppression. I mean, what we do now with intravitreal injections is that we give a big bolus and then it's gone, and bolus and it's gone, and there can be some fluctuation. I think that what we've seen is that this low-level suppression may be disease modifying in a way that we don't see with intravitreal injections. And there's a little bit of data that we've seen for that end too, is that the rates of progression of atrophy seem to be less with the PDS patients than with the intravitreal injection patients. And so there may be some benefit to it just on the continuous suppression. Now, there are other risks of complications. These once in a while they can become eroded, or there can be conjunctival retraction. There's a risk of infection, and we concern ourselves with that. But I think with good surgical technique, the new refill needle, the learnings and the teachings that we've obtained over the years, I think that the rates of endophthalmitis seem to be dropping and are in a reasonable range. And actually, most of the cases that had endophthalmitis still did very well. And if you look at more recent cases, most of them continue to get refills later on after we treat the endophthalmitis. They can leave the device in and still have refills, and most of them, their vision ends up pretty good. So, yeah.
So safe.
Safe. It seems pretty safe. But again, more complications than a simple intravitreal injection, but much fewer intravitreal injections over your lifetime. So you have to weigh that against
control of the disease.
and better control the disease. Yeah.
Thank you very much.